So do please send in your comments, send in your questions, whatever it is that may have been on your mind, so that we can start to respond to them. We have a few already, so Titi and Toyin, I'll be shooting them out to yourselves. I think this goes to Titi. Says this vaccine is virtually new and the long-term effect is unknown. Regarding youths 18 plus taking the vaccine, my question is, has there been any research done around fertility, childbearing, and sterility? So are there any views on that? Any?
Yes, obviously what I will use is that there is no current evidence of impact on childbearing and fertility. And in fact, the information showed that during the trial, a number of participants actually got pregnant. That wasn't the intention, because they did want to exclude pregnancy from the trial, but a number of people got pregnant, and that's still being monitored on track. And it goes back to what I said about that they will continue to monitor these things, you know, to be clear on any long-term effects. But at this point in time, there is no current evidence that it has any impact on fertility and or pregnancy. And I will finish by saying this, because I have been asked by a number of people by this, and I said, but there is evidence that if people have COVID and they die or have serious implications of COVID, that might actually have an impact on them, even getting pregnant, or even you know, living to get pregnant. So again, it goes back to making sure that you take and you use information based on, you know, objective concerns. And if people really are concerned about, because there are different reasons for infertility and challenges, is actually they do speak to their consultant and if need be seek specialist advice. It's very important people do that, because every individual is different, and what drives fertility and infertility is different for different people. So it's very important that people seek their own specialist advice.
Okay, great. Thank you very much for that. Can we mute yourself to minimize? Yes. There's a question here. I am diabetic with heart stents and asthma. I'm 63 and I'm informed according to government criteria, I'm not, it looks like the person is suggesting, because the question was not completed, that I'm not extremely unwell or something. Does this person fall in the category of those who should be in priority list?
So I think what the person is probably talking about is the clinically vulnerable list of cohorts that has been prioritized. Not knowing the person's personal circumstances, the first thing was whether they were registered by their GP as being clinically vulnerable. And this is another thing that I personally have found out, is that sometimes our records with our GP, because if you don't seek if you're not, it's how you're recorded on your GP's record that would determine whether you have been classified. Having said that, and I'll put it in the chat for everybody, having said that, just a few days ago, the government did update the clinically vulnerable list to even include ethnicity and postcode, because there are areas where ethnicity, in terms of the challenges and, as we know, the impact it has had on the community, but also where the data shows that there are higher rates of transmission and death has been in a number of areas. So they've also included postcode. But for that particular person, if they've got a lot of clinical conditions and they do believe that they're at risk, I would suggest they contact their GP. That's the most effective way. Contact their GP. And I would suggest, don't contact your GP to say you want to get the vaccine. Contact your GP to say, because if you say you want the vaccine, people will tell you to go to a helpline, because GPs are being inundated with so many calls, you know, I want my vaccine, when am I going to, and then you will be directed to a call center line. But actually to contact the GP as a patient registered with that GP to say that their clinical conditions and they therefore want advice on getting the vaccine. That actually is the most appropriate way of accessing that sort of advice. Yeah. but I will put the information in the chat on clinically vulnerable, so whoever asks that question can see it.
Can I also mention that especially most of us in our community, some of us have conditions which have been diagnosed back home and haven't actually informed their GP, either because of, for whatever reason known best to them. So it's important at this point that if there are any conditions that you haven't declared to your GP, it would be a good time to actually declare, because you might fall within this clinical group of people who need to be vaccinated. And I think that's quite important.
Excellent. There's just one other question around this same topic. It might be the same answer. So we'll take that and then we'll go to Anne, who's here now, and then we'll come back and deal with the rest of the questions. And it's good to see you, Anne. It says, my daughter is on a multiple medication. Will this vaccine have any adverse effects on her?
Again, GP,
Yeah.
the best person. And the reason why I say that, and as like Tony said, the GP holds all records of patients. If you go to the hospital will update your GP about your condition. So the GP holds the master copy of everything that you have, and they're therefore their best place to advise you. So if that person is on multiple medication, every letter from whichever consultant had prescribed the medication will be with the GP, and the GP therefore will be able to give them the advice.
Okay, great.
Can I just jump in on that as well? Which is it's absolutely right to go to your GP. It's also the case that the vaccines don't interact with medicine. So of course, if you're nervous, go to your GP. I mean, absolutely, without question, that's what they're there for. But also know that the vaccines don't interact with other medicines. So you don't need to be nervous, but if you are, then of course speak to your GP.
So just before you go on there, I'd just like to remind everybody that there will be a feedback form coming out to you during this question and answer time. Please, could you fill in the feedbacks and return them to us? We'd like to know how to improve our services. And if anybody is out there who wants to talk to us privately, please put your details there and we will reach out to you as soon as possible. So over to you, Pastor.
Thank you very much, Rami. There's that big elephant in the room. I'd like us to slay it fast. And you and I spoke a bit about that. And I'd like to hear your view as well as then hear Titi's view as well. Ethnicity and the virus/the vaccine. We're a predominantly Afro-Caribbean community. There's a history to misdeeds that were committed upon us in the past. So how do we know that there aren't two versions of AstraZeneca, one for blacks, one for whites, and two versions of Pfizer, like in the same vein?
So, I mean, I would say, I'm sorry, but, you know, I'm apologizing for 400 years of atrocities committed by a whole other group of people, including myself. So first of all, I think it is incredibly important that everybody working in the roles that I'm working in acknowledges those truths and does not in any way dismiss that history or that truth or that trauma that is held in the self, in the community, in the body, and the experience. So that's the first thing to say. In terms of how do you know, there aren't two versions of the vaccine. There aren't two Pfizer. There isn't. I mean, and someone asked me this the other day. She said, "Why are you asking me my ethnicity when I'm signing up for the vaccine? Is that because there's a black cupboard and a white cupboard?" And I said, "No, that isn't why. It's actually because we know we're doing a pretty bad job supporting people from Black communities, particularly Black communities, to feel comfortable to get the vaccine. However, really important lesson for us in how we ask the questions. I mean, the only way I can really properly tell you this is if you're really worried, go to a vaccine center and queue up behind a white person and make sure they use the same vial. I mean, and I'm not being flippant, but there really aren't two cupboards and they really aren't using one vaccine. I guess the other answer is everyone can choose. So somebody asked about how to choose, and I'll come back to the operations of it. But you can all choose, we can all choose which vaccine to have. And so if you think, like many in your community do, that Pfizer is not a good place because of some pretty nasty things Pfizer has done in the past, then don't go and have AstraZeneca. Just don't make yourself confront, that history when there's another option. I'm not, and we've said this to the hospital. So the hospital staff, the vaccine in the hospital is Pfizer. And we have said, let's make it easy for hospital staff, particularly from Black communities, to get AstraZeneca because of the history of Pfizer. But beyond me sort of telling you there aren't two cupboards, there aren't two cupboards.
Can I also mention, it's quite interesting you said that, because I had an experience with one of a carer who said to me, I was quite skeptical about taking the vaccine, but the day she took the vaccine, she had to take one of her clients to get the vaccine, and she was white. So she said, can I have from the same vial, please?
I'm sort of not joking. And I might go and suggest to Jason, who's mine and Lizzie's boss, who's the director of public health, that we do a buddy system. I mean, we can't because you're not allowed to see anyone else, but like, I'm more than happy to go with anybody who wants to be my, like, this is gonna sound awful, my Black person buddy, and be the canary and take the vaccine first if you want. But
Okay.
I am not, that sounds flippant, I am not in any way flippant about this history, okay?
Exactly.
This is a very, very serious thing, and it is explicitly why this is the second Saturday in a row, and I will do this as many Saturdays as I can. We'll spend my Saturday evenings having conversations like this, because, and it's why we have vaccine peer supporters who speak multiple African languages, because fundamentally, as I said before, I'm not going to convince everybody, and I get it, and that's fine. So I'm not flippant about this history.
Yeah.
Titi, I'd like your take on this as well.
Yeah, I'm just to build on what Anne and Toyin said. So there is recognition by the NHS and system leaders that actually racism and mistrust, historical mistrust, does have a significant role to play in our concerns. And and everybody will recall, at the beginning of the height of COVID, the faces that were seen were really from the Black, Asian, and minority ethnic group, as in terms of the impact. And to think that that has gone away is really, it hasn't. There was actually a meeting on Monday, which I was part of, where the CMO, Chris Whitty, and all the system leaders from across the NHS actually had a meeting with BAME Healthcare Professionals Group, where we did raise our concern. And our concern is the institutional racism does play a factor, because you can't, trust is earned, you can't, and that earning that trust is the issue we all have. And that therefore impacts on people's social connection to the system. And there were a number of issues that were raised as an example. So trusted information, trusted people, and trusted platforms. So a trusted platform to members of our community might not be BBC, to be blunt. So we asked, why don't they use the ethnic media? Why aren't they using the trusted platforms that we see as trusted platforms? Why aren't they using trusted people that, so this event that you're hosting today, Pastor, is a trust platform for your community. And therefore, using these platforms are very important. Understanding how we congregate. How we congregate is not necessarily by local authority. We congregate by community groups. We congregate by our countries of origin. We congregate, and not understanding who we are means people come up with different solutions. And at the heart of that requires humility, honesty by people in leadership. And it was really a very inspiring event for the system leaders to hear that actually there needs to be a shift in the dial in terms of building that trust that enables people to trust what you say and trust the information you give. So, and I would say it as a Black person, the NHS I would describe, I say to people, it is diverse in workforce, but it is not inclusive. you know, there's a report called the Snowy White Peaks in the NHS. The higher you get, the whiter it is. I'm a black person in a sea of white, and it is tiring sometimes when decisions are being made and it's being made from the lens of a white person, because your lens determines how you make decisions and how you process things and how you do things. And these are the things now that the NHS has been charged with. They have to improve representation at the top so that decisions are made and processes from the lens of a white person. You know, I always believe that we are easy to reach. There's a word that we've told people to stop using, hard to reach, because I actually believe our community are the easiest to reach. But if you have to know how to reach us, and you have to be comfortable with our own avenues. And I said, you know, it is through our religious community groups. My goodness me, if you go to, we said someone said if you just touch maybe 10 top churches as an example in the UK, and actually those top churches are not the Church of England if you want to reach the Black African Caribbean community. But that might be the way the English person sees it, through that institution, and we're saying, no, it is these churches out there that are not on your radar that you need to target, and then you will reach, the impact will be there. So these are things that we're talking through, but it is important to recognize, as Anne said, and the leaders are beginning to recognize that, because it is not just about the vaccine, to be honest. It's also about the inequalities and the disparities that we need to address. And these are some of the things that will help that journey.
Now, there's a question here. Is it true that the government said the pharmaceutical companies will not be held responsible if anything goes wrong with the vaccines? It is true anyway. So, I mean, can we understand that? Why is there no liability clause in their contract?
So I don't know. I haven't heard that, and I have just messaged the WhatsApp group that has the vaccine experts in it to ask them the question. And when I have the answer, I will come back to you. But I'm just talking to I'm messaging the director of public health in Newham at the moment to tell him that you've asked that question to see if I can get any answer. I don't know. Yeah.
Hi everyone, I'm Lizzie. I work with Anne in the public health team, and I mean obviously the vaccination companies are regulated by the MHRA, so they are accountable to them. So they have to give reports regularly on any sort of like the things that Anne was talking about in terms of like any adverse reactions or bad things that happen. They have to, in terms of what they're allowed to do by the MHRA. So what they're allowed to do is actually quite controlled by what the regulatory authority dictates to them. So they do have parameters. Yeah, just to add that, if that's helpful.
Thank you. Yeah, there's a question here to you, Remy. If I get the vaccine in the UK, can I catch another variant if I travel to another country that has a different variant?
Well, the answer to that is maybe, in that it depends when and which vaccine. You know, if you take a vaccine now in the UK and you travel to a country with a variant that we haven't researched and updated the vaccine for, then yes, there's a chance you can get sick from that variant. In the long run, in the kind of medium term, every variant that is identified in any country, the vaccines are then tested against whether or not that variant exists in the UK. So the UK is not saying, well, that variant that exists over in New Zealand, we don't have to worry about because it's a long way away. We are looking at the vaccines against every variant, but we don't necessarily know every variant when we're doing that.
Okay. There's another question here. I'll rephrase it, but it's essentially saying, with regards to the testing protocols, should testing be done regularly, like once a month? And how does testing relate with the asymptomatic? So
do you mean testing for COVID, not testing the vaccine? So if you're getting regularly tested now, because you're somebody who goes out of the home for work or caring or volunteering, you should keep getting tested. And the reason that you should keep getting tested is back to the transmission point, which is that the vaccines protect you from getting sick, We're learning more and more, particularly about AstraZeneca's capacity to protect you from passing the virus on. But at the moment, they're primarily about keeping you from getting sick. So you could be carrying COVID, not know it, and pass it to someone else. That's why you should keep getting tested.
Okay, and I guess a follow-on question. So,
Sorry, I feel like maybe you should be answering these questions, and then I've just not read the list.
No, that's fine. And I was just going to say, one of the key reasons also is in places like the NHS, we do our staff to test every 2 days. No patient will want to come in and get COVID from the person who's treating them. So really, it's very important that people do test every 2 days.
okay, now I guess the dimension of a question is, so we who are sort of home-based, we're not medical workers, we're not key workers, should we need to go for tests, or should that be only a function of symptoms? When should the average person be concerned enough to think I need to go and get tested?
So if you're not going out, if you're not seeing other people, you should not go and get a test unless you have symptoms. And the symptoms in particular you should pay attention to are the fever and the shortness of breath, and the loss of taste.
Excellent.
Yeah.
That's it.
Is that, yeah.
That's it. Did Titi want to add to that?
No, and the public health. So those staying at home, it's for public health reasons.
Titi, I'm not usually on a call with an actual real doctor. So can you have like a red card, a yellow card, and a green card that can we make this a test? I'm also very good at letting other people talk. So can we just make an exam and we'll see how I do?
You're doing a great job, Anne. You're doing a great job.
Doing good on a Saturday night, everybody.
Yeah, you did a great job. Yeah.
I have a question here, and it's particularly interesting and helpful to us. Again, I'll paraphrase it. It says something, it's talking about those fake emails that are purportedly coming from NHS. And then when he clicked on it, it saw it was from an email account. So the question I'm going to be asking is, how will people be informed when the NHS wants to reach out to them to say, we're ready for you to come and take your vaccine? What should people be waiting to receive?
Okay, so there's a short answer and a long answer. The short answer is you should get a letter or a phone call from your GP. That's the short answer. The longer answer is that the post is not doing very well and the GPs are very busy. And so there is actually a phasing where when the new groups get, we have a list, so I think about it like this, right? When the list gets expanded, that group is allowed to book through their GP or 119, and then after a certain period of time, they're allowed to book through the website. I mean, if you're in Newham and you join the Champions program, we send that information out regularly, or if you know someone it's very easy to join the Champions program, by the way. You just give us your email address, and if you want to be on WhatsApp, your mobile phone number, and then you're in. It's that easy. And we send you information and you can ask us questions. So that's the kind of short answer. The medium answer is, and the tactical thing, this is, I think, what I would do, is once you see from the press, which you will, that your age band is now in, and you know you're not a frontline, let's do age. Once you see from the press that your age band is in, so now we're at 65 plus, I would go to the website. I can put the web address in the chat and just check every day or so if you're allowed to book. And at some point you'll be allowed to. And that potentially is quicker than calling your GP. And if you have friends or family who aren't great at the internet, but are willing to tell you their name and NHS number, do that for them. If you're a frontline health and social care worker, and as we expand the frontline workers, and please, can we get to the schools and the firemen and the police, or the fire and police services soon? As that expands, people are told by their managers. So that comes from your manager. And in terms of at-risk populations, the shielding group that got made broader, that was put into the chat, the long list that TT put in the chat, that group was informed by a Department of Health and Social Care letter. In Newham, because we're a bit faster than the Department of Health, we also sent out a text and a letter, and those are real. And yeah, she's absolutely right. There's stuff about how to spot scams. The easiest way to spot a scam is if they ask you for money. You never have to give money for this.
Yeah, okay. Okay.
I would just I would just look at the age range and then check the website.
Excellent. I understand the people who have a hands up. I would suggest please type it in because we're trying to manage our time so we can be efficient. And so we're grouping questions. We're making sure we cover a good broad spectrum. So if you have a question, type it in, and it will be reflected upon. There's a question here. I'll ask it anyway because it's a question. But it says, is it true that GPs are getting an extra £30 per vaccine? I guess it probably speaks to motive and objectivity.
Yeah. So no, it's not true. They are getting paid a bit extra to give the vaccine. That's a very, very normal thing in the GP contract. So GPs have a contract with GPs are independently owned businesses, and those businesses have a contract with central government. I think the last contract was a few years ago. There was a massive furore, that there was strikes. But there is a contract, and the contract says this is what we do for this resource. And so when, like any job that any of us have, you're asked to do something significantly different and significantly additional, and you're bringing people in, you're bringing equipment in, you're buying syringes, you're having to store stuff, so you need more storage, you need money to have those resources. So I asked, and I got told it's £12 a vaccine. I have no idea if that's that's what our GPs in Newham have told us. I don't know if that's a good number or a bad number. But I trust the contract between central government and the GPs enough to know that if they're doing something extra, they're doing it at an appropriate price. And this is personal, this is not line from the public health team, but personally, I'd be more worried about the contracts that Hancock's giving out than the GPs somehow making, hay out of COVID. But yeah, they, if anybody, this is being broadcast, isn't it? Oops.
It's okay.
Don't tell Jason, Lizzie, just don't tell Jason.
Go for it, Anne.
I think
we're all behind you.
I think the GPs, I don't know about GPs outside of Newham. The GPs in Newham, the head of the Newham Clinical Commissioning Group, who's a guy named Mohammed Nakfi, who goes by Wax, is talking to me right now to answer your questions. I have never seen it. I get a bit blithy about it. I mean, the commitment and the effort and you send him some random person who said, I can't get my vaccine, and he fixes it. And that's the way everybody seems to be behaving. And so I think if the GPs are getting money, they're getting it because they need it to buy syringes and storage and hire people and do extra work and that kind of stuff.
Can I just add to what Anne just said? I think people are so fixed on the COVID alone to forget that actually the GPs are also delivering other services. And the work that people have done over the last 1 year in the NHS, I mean, I say to people, the sustained pressure, the intense pressure, the risk and the work that people have been undertaking, I don't think money can ever compensate for that. People have made tireless sacrifice. It's been intense for 1 year. We're actually, as an executive managing director, I'm actually concerned that the burnout is such that when it dies down, as I said at the beginning, the people who are waiting for cancer treatment, people who are waiting for elective treatment, it's another tsunami. Mental health impact, there is another tsunami waiting that we need to be mindful of. So I don't think money is the motivation of anybody working in the NHS at this point in time.
Right, excellent. Okay, I think Anne or Titi, one or both of you alluded to this, but there's a question here specifically about how long do we expect the vaccine cover to last? 6 months, 1 year, 5 years? And with the mutating of the virus we've already seen, will we be expecting another vaccine creation?
So I think that's Anne, your public health. They like data. They do lots of data analysis and population health. So I'll hand over to Anne.
Oh, let me just be really clear. Also, I've just messaged my director of public health and said, we desperately want you in everything we're doing, Titi. When you meet him, he's the most undata public health person I've ever met in my life. It's all about people and not about numbers. I mean, that's not true. He does numbers, That being said, we don't know. We do not know the answer to that question. It doesn't look like the kind of vaccine that we have for flu. So it doesn't look like it's going to need to be every year, but we don't know, because also COVID is pretty darn smart at mutating. And so we just don't know. And the research is going on and on and on about that all the time. We don't know whether responding to the variant is about creating new vaccine or broadening the current vaccine, making the current vaccine sort of apply to, is it a tire that only fits one car and then you need a different one for a different car, or is it a generic universal tire? We don't know. And what we do know, back to the data point, the point made about data, is that the researchers are looking at this really carefully. And the regulators will look at it, as Lizzie said, the regulators will look at it really carefully to approve anything.
Excellent. We do have a question here that I'm going to, it's a question. I'm going to answer it, but I'm going to read it out. So essentially, this person is watching from Canada, and they found this very useful, this session, and they were hoping that if they could pull some people together, would we run this for a Canadian audience? Now, here's what I respond and to that. I know for a fact that Anne is focused essentially primarily on the borough of Newham, and I don't know what the stipulations of our role are concerning an international audience. There's also the fact that there are local variants to all of what we've been talking about here, the Canadian health system and all of it. But having said that, and I'll give the panel room to speak as well if they have anything else to add. Having said that, subject to the agreement of the three speakers, we can and will plan to put this on our YouTube page, so it becomes available material, and you can then point that at your audience, and then people would adapt that to your local health delivery system as is appropriate. Anne, would you agree with that? Titi and Toyin, would that be fine with you guys?
I was going to say, and I can also actually signpost you, because, and I'm sure Toyin can, being sort of a medical person, we've got our colleagues globally dispersed, and a very vibrant medical community, as you know, of diaspora doctors and healthcare professionals in the States, in Canada, and other parts of Europe. So I could ask, if, through the pastor, I could ask the question of my contacts who are in Canada, because this is being done globally in different parts of the country, because it's a global pandemic. Everybody's doing this. So yes, I can support the process, because it's good to have the local context. It's the local information that they need, because that is where they will get their vaccine, and how they will get their vaccine. I'm very well versed in the NHS and process structures and systems, but I'm not very well versed on Canadian process structure and system. But our contacts, colleagues who are in those countries, will be best placed. So through the pastor, it's something that I can support, Pastor.
That's good. So, anything else, Doctor?
Well, yeah, exactly what Titi has said. And we also have colleagues in Australia as well. So we're quite vast, and also in Trinidad and Tobago. So we're actually everywhere.
Excellent. Anne?
I don't think Newham's going to pay my salary to talk to the Canadians. That's a joke. I mean, I think using YouTube is the best way forward. And unfortunately, I don't. If you'd asked me about New York or North Carolina or South Carolina, then I could say I could put you in touch with people. But I don't have such a exciting and diversely reaching network. But I mean, absolutely happy for it to go on YouTube. And I think the local thing is really important, because the rollout protocols are different by country. The availability of vaccine is different by country. The pace and process by which people are doing this is different by country. And while the vaccine is the vaccine, I think we need to I think our questions are often are kind of emotionally tied up with a bunch of those things all mixing together, and our own relationship to the country in which we live. And so it probably makes most sense to do it locally.
Can I just add there that for those of our audience that are in different parts of the world other than in the United Kingdom, when the feedback form goes out, if you would like to be in touch with contacts in other countries, please put it in, there's a section there, please put it there and how we can contact you, and we will do so. Thank you.
Excellent. Yes. Okay. I don't see any more questions having come through.
There's one about the home testing kit accuracy.
Oh, there you go. Okay. Do you want to take that then?
You want me to? I mean, the home testing kit is a PCR kit. Someone else can define what that means, and it's pretty accurate. I guess the other way to ask this question, the other way to answer this question, this is a public health perspective, actually, not a clinical perspective. And so I'm sure there's a clinical perspective on this as well. But the reason that we ask people to get tested is to prevent transmission, so that people know if they have COVID and don't take that COVID to somebody else, right? And so if the tests weren't good enough to tell us enough about who is positive and therefore prevent transmission, we wouldn't be using them. We would be using something else. And that's why we're comfortable with both the at-home tests and the rapid tests, even though they're not 100% accurate, and nothing ever is. And also, I haven't done it, but it sounds pretty unpleasant to stick something down your throat and then up your nose. So there's that piece as well. If we didn't think that they worked as a mechanism to keep people safe, we wouldn't be using them. So the public health perspective on this is they are a tool that helps keep people safe by preventing transmission, and they are good enough at doing that we should use them.
Excellent. Thank you so very much.
I don't know if there's a clinic, sorry.
Say that again?
I was just saying there may be a clinical answer to the question, is like a doctor answer to the question.
Do either of our doctors have anything you want to add to that?
Yeah.
Okay.
You said it all.
I'd like to, we have a minister who's going to be doing the formal vote of thanks and closing us out. But before we do that, first I'd like to appreciate all three of you, interestingly, all ladies, and Elizabeth. Thank you for coming. Thank you.
Sorry, Pastor. I do apologize for cutting you short, for butting in, but there is just one question, and that goes to Dr. Toyin. And the question was that how do you deal with the suffering that accompanies losses as a result of COVID? And you did mention that if somebody grieves for more than a year, they need to seek help. What kind of help, and where can they get that help from?
That's a good one.
Thank you so much for that question. Yes, where do you get the help for? It depends on what part of the country you are. Because in the UK, there's so many organizations that actually work with bereavement. So it could be local. I always say home is always closest. So sometimes it's just family. It might be the church. It might be stepping out of our comfort zone, because some of us, when it comes to bereavement, the psychologist is the last place they want to go to, because it's not what we do. And it's also around the stigma. So what I'll suggest, if you're going through a bereavement and you have close family friends, I'll suggest have a conversation with people who will listen to you and help you through. If you are lonely, because some are actually living alone, so we need to acknowledge that people do live alone and they probably don't have family around them, then whichever community that they're in, whether the church, the mosque, or wherever they feel safe, is another place they could go. But you can also reach out to your GP, because the GP will also direct you to places where you can actually seek help as well. So don't feel you're in it on your own. There are people out there who will engage with you and help you through. And sometimes you might have groups where people have lost people for a particular kind of illnesses as well, where they can actually understand what you're going through and give you more information. Your best friend might be a doctor, but she might not have a clue about what you're going through, because sometimes people have this perception that doctors know the answer to everything. The honesty is that we don't know the answer to everything. So your best friend who is a doctor might not be the best person to give you that support. So that's what I'm saying. So look out there. There are support out there. There are things you can do by yourself as well, which is actually having a positive mind, like I mentioned initially, switching for whatever the cause of the thing is into the positivity and the benefit that you actually get from that being creative within that environment of going through bereavement. So there's a lot of things out there to support you. For other people from outside the country, just, I'm sure if you ask, for those who have doctors, GPs, or in organization, you probably will find somewhere where you can actually get additional support. But the first support is usually friends and family.
Excellent, thank you. And actually that very nicely ties into where I was headed. I was going to say, I wanted each of our speakers to leave us with a key message over a minute and a half or so. So Toyin, I think you literally just did that. So we went on to Anne, and if you could just, what's the message you want to leave us with? Sort of like in a minute and a half or two, and then we'll wrap up with Titi in the same, and then we'll call Taiwo to close us out.
So the message, it's a really good question. This is a personal and individual choice that you make in your own context, in your own relationships, your own sense of risk, your own sense of trust. From a public health perspective, we'd really like that choice to be that you take the vaccine, and we're here to do everything we can to help you feel comfortable doing that. We don't expect you to skip in thinking, you know, this is the greatest thing I've ever done. We appreciate the choices that people are making, and that's what we're here for, is to have these conversations so that ultimately you feel good enough to take the vaccine. But with learning every day how to be respectful and open and alive to all of the different reasons people are making the choices they're making. And thank you for having me, and us, and Lizzie and Linda. Thank you.
Thank you, Titi.
So I'll start, because I know the audience we're speaking to, and many of them are church-going Christian people. I'll start with the first thing about love yourself, loving yourself, because not doing what is required means you don't really love yourself. And then obviously, Pastor, that's for you and your wife to manage. But the key thing is loving yourself and loving your neighbor as yourself, but also make sure you don't perish because of lack of knowledge. So what we have given you is knowledge, and what information is not knowledge. So when I mean that information, I'm talking about information on social media, and I keep on saying it, or word of mouth. And one of the things that Anne, I said when you went here is everybody's become an expert on COVID. Oh my goodness me. So that means that there's so much misinformation out there, deliberate or ignorant. So you have to make sure you become knowledgeable, and you therefore apply that knowledge, not just for yourself, but for the younger people. I am more concerned now about the younger people, the impact this is having on younger people, their education, their way of life. I mean, 1 year of lockdown on younger people it's going to create for some people a lifetime impact. Therefore, it is imperative on every one of us to therefore make sure we use the information, we make informed decisions, but like Anne said, on the side of understanding the impact. So I want to leave with everybody that everybody has a role to play. This is not about somebody else's responsibility. This is about everybody being responsible and advocating and communicating, so that not just ourselves, but actually the next generation can thank us for what we did.
Thank you so very much. Remy, over to you.
Thank you so very much, Pastor, I said Pastor, well, Dr. Titi, Dr. Toyin, and Anne, as well as PJ and PYO, and Elizabeth that has also supported. I believe that you have had an interesting time, an informative time, and you can now make up your own minds as to whether you want to take the COVID vaccination or not, now that you are informed. I also want to say, if you do have any questions regarding bereavement or grief as a result of losses, we're also here to help. Open Eyes is a ministry that is there to help people go through challenging situations. We do have many other programs which we hope you will attend, not just on COVID. We deal with other issues like domestic violence, we deal with mental health, we deal with disabilities, and anything that arises during the course of the day. So I just want to say thank you all for attending. Please complete the feedback forms, which I believe have been sent to your email boxes. And if you do want further contact, please give us your information. And on that note, I will say thank you very much. God bless. And I'll hand over to Deacon Taiwo Shafora.
Thank you, Minister Remy. I echo what Pastor Ziemi, and obviously I haven't heard from my Pastor Jumoke today, but I echo what Pastor Ziemi and Jumoke, and obviously the members of Trinity Chapel are saying to the speakers today. Thank you so much for your time. We appreciate your honesty more than anything, your candor, your wisdom, and of course, your knowledge and experience. It's not easy talking about such a topic at this time. Dr. Toyin Magbagbeola, I love the talk about bereavement because it's something that most of us perceive negatively. What I got from that is we need to learn that we need to find out what we should be learning at the time of bereavement and post bereavement. Dr. Banjoko, thank you for demystifying COVID-19 and the vaccination for us. I spoke to a friend a couple of days ago, and he had his vaccination. I think he had his vaccination and he had COVID, and he was now saying that if not for the vaccination, he wouldn't have been celebrating his birthday last Thursday. And he said he's going to be a champion to ensure that as many people take the vaccination as possible. And Bowers, excellent. Thank you for your candor. I work in Newham, and I know you guys do a fantastic job there. Well done. We appreciate everything you said. Obviously, when it's my time to take the vaccination, I will be going with my wife so that she can drive me back home. Thank you so much. As speakers, we appreciate you a lot. And as my colleague, Minister Remy has said, we've sent the feedback form to your email addresses. It's also in the chat here, and the QR code should also be there for you. It's only about 6, 7, 8 questions for you to answer for us, so that Open Eyes Ministry and Trinity Chapel can do better and look at more topical issues in the next few months of this pandemic and beyond. I can only but say thank you so much. And to everyone that has joined us today, God be with you.